Why does left ventricular failure happen? It could be a problem of the aorta, coarctation of the aorta, or aortic valve stenosis. Aortic coarctation is a narrowing of a part of the aorta. The condition forces the heart to work harder to pump blood. Aortic stenosis. The valve between the left atrium and the aorta is narrowed and doesn't open fully. This reduces or blocks blood flow. Now, it could be a cardiac muscle problem. In a patient who had myocardial infarction, which means some of the heart muscle is dead now, which may cause the heart to fail. Or, it could be due to ischemia, which means heart muscle is not getting enough oxygen, so now it cannot work properly. Or, it could be cardiomyopathy. Then again, it could be fluid overload, which occurs in aortic regurgitation. In aortic regurgitation, the aortic valve doesn't close properly. This causes blood to flow backward from the aorta into the left ventricle, thus the excess fluid causing the left ventricle to not work properly. Or, it could be due to pressure from the outside, like pericardial effusion. In this condition, fluid accumulates in the pericardium and hampers the systole and diastole of the heart. Now, the most important one. Pressure overload. In response to elevated blood pressure, the ventricular hypertrophy compensates for the increased wall stress. However, the ventricular hypertrophy involves numerous structural adaptations that may lead to ventricular dysfunction and, eventually, heart failure. So, when there is excess blood in the left ventricle, it backtracks via the left atrium and the pulmonary vein into the lungs, where the blood leaks into the lung tissue. Now, the macrophage in the lung tissue eats the RBC, becomes heart failure cell, and causes inflammation, all of which leads to pulmonary edema.